Yes, Ronald.
Hello, Malim.
Yeah, you are saying something.
I can hear you.
Yeah. I've just said now they are online. I was waiting for you from 4. When you said you logged in, I couldn't see you here. But now it's okay. Now, today we're looking at chapter 5, or rather lesson 5. Lesson 5 of our coursework in this unit. We are remaining with 3 topics for the next 3 weeks. So I would expect that you go through the assignments that I've given you. I have given you also some quizzes. I would expect that you go through them and do them appropriately within the time limits that I've given you kindly. So with lesson 5, basically, it's focusing on the influences on food choices with a focus on those that can be changed, or rather we can work on them. They are amenable to change, and we are also discussing about some successful interventions that have been done in terms of food choices and have been helpful to different individuals in different places. So our objective in this topic are that by the end of it, you as a learner, you should be able to discuss the major influences on food choices and also discuss some successful interventions, be able to differentiate, or rather look at the food choices and look at relationship with health status of individuals. Yeah, so basically we're focusing on the determinants, which are usually about 6 of them in nature, and that is the discussion we have this day on biological determinants, like hunger, appetite, and taste, whereby when we are hungry, we need food, so you're likely to reach out to eat. When you walk on the streets of Nairobi or wherever, even in the estate where we stay, you'll find there's a lot of food that's being cooked by the roadside, the mandazis, the chipos, you know, several parties, githeri. So you find that when people feel hungry, they're looking at what is available, they can easily reach out and eat the smokies that are available all over, and of course for them they're not healthy. So aspect of hunger is a biological determinant, like it will determine what you eat, when and how, or where. You know, appetite, you know, having a taste for given type of food, and also taste depending on how you perceive whether it's good for you, whether it's palatable, whether it's sweet, you know. So we shall delve into that. And economic determinant and availability. You can have money, but maybe the food is not available in the market, or the food is available, but you don't have sufficient money for you to acquire that food, to get that food on the table in the house. Then physical determinants like access, education, skills, inclusive of the cooking skills, because if you don't know how to cook food, chakula bora, you know, and if you don't have enough money, again, you'll just buy chakula, you know, bora chakula, si chakula bora. And also time in terms of maybe cooking. So like, githeri will take like 2-3 hours for us to cook, and other foods like rice are likely to take us less than 40 minutes, you know. So people are likely to go reach out for food that they can cook in lesser time because of also fuel that is expensive. Find that gas is expensive, charcoal is expensive, paraffin is expensive. So whatever cooking method one would want to use, or cooking fire source that one would want to use, it will depend. Then social determinants are about the culture, family ties, and also meal patterns, how we've grown up, the way we eat, whatever we eat in our families, how our cultures have socialized us, what is available and what is good for us in the market. For example, if you bring kumbe, that is the white ants, in like Nairobi, very few people will purchase them. Maybe those who are from regions that consume such, like the Western region, they'll not have a problem purchasing such, and because they are very nutritious in terms of high protein diet. But the other people from other communities may not consume such because it's like a food that they're not used to. You find that food like mokimo, the mixture of peas or beans with waru and some of the pumpkin leaves. It's very common in Kikuyu. So you'll find that like in other places within the country, it's not very common. So you may find such people may find it hard to consume such food when they have been cooked. It is about cultures and the male patterns and family socializations. Then we have psychological determinants such as mood, stress, and also guilt. And with that, you find that sometimes our mood will make us eat what we eat. You may feel like eating something, or even stress. Some people eat away their stress as in they consume a lot of food, but others don't eat at all. So with that, again, it takes a toll on their health, or it will affect their food choices because they may end up snacking, especially on unhealthy snacks like sweets, the chewing gums, things that are not helpful to the system. Others even feel guilty because maybe they didn't consume a certain food. They feel like I should have consumed, so they feel guilty about it. That is a psychological issue. Then lastly, we do have the attitudes, beliefs, and knowledge about food. Like when you know about a given food, the way it is should be prepared, or the nutrition content of that given food, or the health benefits that comes with that given food, you're likely to make more informed choices compared to that person who has no knowledge totally about it. So about biological determinants, I think in a nutshell, what I've mentioned is that we have hunger and satiety-related issues, whereby if you feel hungry, you're likely to reach out and eat food. Now, depending on where you are or what you can afford at that particular time, whether you're at home or at work or on the streets or working somewhere out there, you're likely to either take nutritious food or maybe food that is less nutritious because of that high satiety. But it's a drive, it's a determinant that makes you eat whatever you eat. Then palatability about how food you perceive food to be in terms of sensory properties like whether taste, smell, texture, and appearance. And this also goes hand in hand with the sensory aspects of the food, whether it's tasty, whether it's sweet, whether it's tasted to the taste buds. Sometimes you'll find that people will tend to love food, especially the oily foods, the meats, because meat is starch, it is sweet to the tongue, so you're likely to love it more and consume it more. So, and then about the second factor or determinant of the food choices is the economic and physical determinant of food choice, which I've already highlighted in terms of that you know that if you maybe a less good food that is of less quality, just maybe to have something bora chakula, chakula bora, because of related implications. And also that goes hand in hand with income. Our process determine we're able to consume, what you have, you are able to reach out to. Maybe you find some people consuming more of carbohydrates rather than even having protein and vitamins in their diet because of money-related issues. Then we do have education on knowledge. When someone is knowledgeable, he or she is likely to be more informed food choice in terms of what they'll buy even in the market, with whatever little money they have, however much or little money they have. So it's always important to empower people, to tell them information through media, also via health professionals. As you're training to be a community health practitioner, you need to empower people, let them know what is good, let them know they're supposed to consume more vegetables and fruits compared to the carbs and the proteins. Of course, now proteins have more satiety. As you eat, utasikia umeshiba. That's why we usually need to eat a balanced diet at every meal, so that we're able to be full enough to go for 3-4 hours before you do the next meal or the next snack. We do also have the third determinant or factor, which is the social determinant of food choice, which is the influence of social class. Sometimes because of the people that we interact with, they influence us in another on what we acquire or the kind of foods that we may end up buying. Right now, we do have the supermarkets around us, the ready-made foods. You just go carry away foods, carry home. And you're good to you find people. Some people have become so lazy, or I don't know if it's convenient, that for them, you can find a woman buying food for the entire family from the supermarket and goes with it at home, warms in the microwave, they eat, and that is supper. But always cooked food at home is the best, because you've taken care of hygiene, you've taken care of the nutrient losses, especially the vitamins in the vegetables. vegetables and such like. Then social setting again is a social determinant of food choice. Is a part of the social determinant, because again, how we've been socialized, how we've grown up, like in our schools, at home, at workplaces, in the restaurants, because that is where we're likely to eat. We may not really always eat at home because of the nature of like life in Nairobi cities. You're likely to yourself eating away. Maybe you'll just take one meal at home, and most likely that will be supper. So it is important that you take charge of your health, and people take charge, and it's good that we inform them, we educate on them to know what is expected of them and what is right. We also have the aspect on meal patterns, whereby sometimes people have many different eating occasions daily, like the motivations for which will differ from one occasion to the next. And most of the time we find that people will tend to eat sometimes when they feel that hungry. Maybe you've worked for a long time and then you feel hungry, but likely again, most of people, especially working within the town setups or settings, they're likely to snack more than eat healthy foods. So most of the time you're likely to snack on healthy snacks, which are likely to again affect our health. Another factor is the psychological factor, that in which stress is a common feature of the modern life and can modify behaviors that affect health, such as physical activity, smoking, or even food choices. So people behave differently when they're stressed out. I've already said that those will eat away their stress by eating a lot of food, but others will cut on the food, so they will find them growing so thin that they are likely to get wasted in the body because of the weight shedding of weight, which is also unhealthy unless the person was on a weight control diet or needed to do weight control. So basically, stress is not good because it's likely again to lead to other lifestyle conditions related to the cardiovascular system, that is the heart. They're likely to bring about diabetes. We have cancer, hypertension, and it's not fair to the system. But it is true that stress will affect one in terms of what they eat and how they do eat. Also, mood goes hand in hand with stress, because again, depending on how you feel, like whatever you want to, because of how your mood is, you may end up eating on junk foods, the snacks, and not consuming the healthy diets. Then you also have aspect of eating disorders, whereby there are some people who suffer from situations whereby it's like they don't want to eat, or when they eat, they do eat and then they vomit. Some people are obsessed with food, others are suffering with low self-esteem. Depending on the cultural setups, there are places whereby if you are fat, it's like people will laugh at you. So like you need to be skinny and bony, you'll be healthy. But that is an disorder. So such people need psychotherapists to work with them so that they can adapt a better eating, healthy lifestyle. About attitude, beliefs, knowledge, and optimistic bias, we realize that with consumer attitudes and beliefs, people will buy things according to how they have grown up, how they have been groomed, because they have seen their mothers and grandmothers preparing for them, what was common at home. So usually with attitudes, we find that if this advice, for example, like unapata is like from many years, because a lady saw mother using while she was young. Akifika pia ni mkubwa, ako na familia pia anaanza kutumia the same jik because aliona mama anatumia and it had results. So even with food, when you're growing up and you realize that unga ni pembe ama ni soko ama ni ile siaga number one, that's how you'll grow up knowing that this is the best food, and you find yourself using the same. So the same, if you grew up mnatumia, you'll find food that is not so advisable. It's highly processed and it's likely to contribute to other lifestyle conditions. If you grew up having such, also when you grow up, you'll also keep doing that because that's the best flour ever. So our attitudes and beliefs are shaped by our families, where we grow, and that is it. In our study today, again, we have a review on barriers to dietary and lifestyle change, like focus on the cost. I've already said that if foods seem to be expensive, we find healthy foods can be a bit expensive. Their prices are slightly higher, like especially the proteins, they're high in cost. Of course, vegetables are slightly cheaper, but again, when you go to the traditional vegetables, they're a bit expensive. So it will depend with the money that one has. It will depend with the income of someone. So once people focus on the cost of that food, you'll find that sometimes they may not be able to purchase it. So they'll do just bora chakula, chakula bora of costs. Again, the education level also matters. When people get educated on what of consuming the fruits and vegetables, they'll be able to consume them more rather than less of ugali and such. So it's important that governments and authorities also come up to transport for this information, relevant information for such. Also, another buying constraint in terms of what to cook, like I've given an example of kidari or jahe. It will take longer to cook. It may take 2 hours, 3 hours to cook, and that is fuel. So if you don't have a pressure cooker, which is again not usually healthily advised, or if you use gas, you'll use that gas is likely itaisha, because cooking for 3 hours continuous, boiling, it's not even cost effective. So when people look at such and the time constraints and the costs involved in terms of cooking, some of them will go for the low quality foods rather than these foods that could be okay. So people actually go for pre-packed or cooked products, because now they will take lesser time, 5, 10, or 15 minutes, then the food is ready, which of course again is not advisable. Then we also have another in terms of changing food behavior, like people get informed, likely to change, but if they're not informed, that they may not change and know that this is maybe working negatively on them. But again, helping them to change from what they're used to what should work for them, sometimes it's not easy. Now, what about successful interventions? There's interventions that have been done in terms of like educating population, in terms of what should be eaten with the healthy diet, healthy nutrition, and there are people that have taken such positively. Like in workplaces, there have been interventions so that people are able to know that if they don't consume good diets, they'll be at risk of lifestyle conditions. And so you'll find that with the appeal of increasing fruits and vegetables in the diet, it has proved to be successful, especially in worksite canteens, and even price reductions for healthier snacks in vending machines, whereby there is an increase in sales of them, because now people are aware that this is more nutritious, this is more healthier, it's a better option for me. So that is what we are reviewing this day. I do hope that you shall keep catching up. Sorry for internet challenges. I hope that it will be okay in our next class.